My topic for the research project is if a speech-language pathologist is needed within the end-of-life process. Imagine if your loved one can no longer take care of themselves and needs medical attention. Oftentimes, family members would put their loved ones in a medical assisted living facility. It is such a terrible feeling for the family of loved ones to go through such events. Many patients would develop diseases within the facility, and others have lifelong medical conditions that need aid. One common disease that can be acquired in a living facility is dysphagia. A speech-language pathologist or an SLP would be there to help with various swallowing techniques, and they can also improve the quality of life within a patient. An SLP is medically trained in all aspects of disorders. From the time one is born to the very end of their life, an SLP is there to help with all forms of disorders. The end-of-life process or palliative care are medical professionals who are there to assist a patient. Palliative care are those with more serious medical diseases, such as Parkinson's disease, Alzheimer's, and much more. These people help the need of the patient. This can include doctors, nurses, occupational therapy, physical therapy, psychology, and an SLP. The need to prepare an SLP for both pediatric palliative care and adult palliative care is very critical. Pediatric palliative care is very different from an adult due to the fact that there is a smaller percentage of young kids dying. Many people do not know that an SLP is there to take care of older adults in nursing homes as well as pediatric babies. With very young children, especially in a hospital, their speech and language development can be delayed, along with their social and cognitive abilities. This can be delayed as well. With palliative care, an SLP is needed more than pediatric care. Preparing an SLP early in their undergraduate and graduate programs can improve to a deeper understanding on how to help their patients. A study was then performed to understand if an SLP felt prepared for palliative care. With this study, there was a total of 143 responses, and many of the respondents said that dysphagia was one of the main treatments for an SLP. Those who responded felt prepared when they took a death and dying course in their undergraduate classes. Dysphagia is very common to see in older adults in living facilities. Dysphagia needs to be identified quickly or can lead to serious medical risk factors such as dehydration, pneumonia, and aspiration. Although diseases and disorders can have an increased risk of dysphagia, it is also estimated that over 9 million adults within the U.S. report having a swallowing problem. An SLP first needs a referral from a nurse in order to assist the patient for a swallowing problem. Assessment for dysphagia includes a variety of tests such as the oral mechanism exam. This exam can determine if the patient has oral pocketing, bolus regurgitation, and poor emasculation. This exam also includes assessing movement of the jaw, lip, palate, and tongue movement. The SLP can also determine if there's any neurological weaknesses within the structures. One other type of assessment is called the Modified Barium Swallow Study. With this study, the patient swallows foods and liquids with barium in them. The patient is then taken to do a fluoroscopy. This can then help the SLP determine where the patient is having difficulty swallowing at. There are also therapeutic techniques that can be used to help a dysphagia patient swallow, such as sitting positions and having their chest forward and back, alternating between solids and liquids, such as telling the patient to eat a few bites of food and then take a swallow of water, and having someone monitor them while they eat. Parkinson's disease is also another disease associated with dysphagia. A study was then conducted for patients with Parkinson's disease to understand if their quality of life improved under an SLP. The results were that with early intervention and treatment greatly increased their quality of life. With early intervention, this can lead to a decrease in dysphagia. A recent study was also tested to determine if dementia patients responded better with visual stimuli when making medical decisions. This study had 20 participants and all showed signs of moderate to advanced dementia. With the use of visual aids, it is also proven to have an increase in understanding and reasoning abilities. This can help dementia patients to make medical decisions on their own. This research was very critical to my paper, and I think it's very interesting how dementia patients respond to visual stimuli when presented and when asked questions about their medical conditions. Feeding tube placement is a procedure that is also done by a speech-language pathologist. In some cases of advanced dementia, patients can be placed with a feeding tube or a percutaneous endoscopic gastrostomy, PEG. A study was also conducted to see if an SLP believes if a PEG can improve the quality of life for those with advanced dementia. Although there are some SLPs who find that a PEG placement is unethical and does not improve the quality of life, whereas a majority of the SLPs who responded to the study found that a PEG was a very normal procedure and improves the quality of life within the patient. I guess I understand that if it depends on the SLPs and how they feel about a PEG placement. An SLP is needed in all aspects of life, including those in the end-of-life care facilities and palliative care. An SLP can help assist, screen, diagnose, and provide treatment on a wide variety of disease. An SLP is there from the time one is born to the time one dies and is needed in everyday life.